want them to ask me what my opinion is and what I would do, because my opinion and what I would do for my births is usually totally different than from what they want. So first I want to ask them, what is your vision of your birth, and what is your the health status of your pregnancy?
Again?
What is your vision for your birth? Like, what, when you think about what you want your birth to look like and how you want to deal with the healing afterwards, what do you think of? And also, what is the health status of your pregnancy? Like, do you have anything like gestational diabetes or preeclampsia, or are you having any other issues like that?
The birth vision, I don't really have as much just because I feel like it's my first one and just hopefully everything would go well. Like it's hard to have any expectations. Like you always think that it's all gonna go best. I hear like some stories that something could might go like harder, that like maybe like they have to open you, so then I thinking I would not go like natural if they need to get interrupted, like help with the opening or anything like that. um and so far everything goes very well. I just did my test for diabetes, like the sugar test, and I didn't get the results yet, but so far everything was doing like very, very well. No any complications.
Okay. And do you have any close friends or family that have given birth? I expect you would like to give birth vaginally
Yeah.
rather than by cesarean. Okay, so do you have friends or family who have given birth vaginally and have used the epidural and have not used the epidural, and have any experiences that they've had made an impact on you that you think about?
I have, yeah, some friends. One, she took it and she says it was great. One, I have a sister-in-law that with two she took it, with one she didn't, but she was supposed to get like an opening. So, but I just heard that it's like um it's not very good. Like it's lowers the blood pressure and after it could pass to the baby. And back in the days, even like when my mom was giving birth, like she never heard of such a thing. So she says like
Right.
we needed all of it. Like so
Yeah.
uh I was thinking that maybe I wanna try without, if there's no like any complication, the baby lays down like correctly, and if the opening is doing everything goes well, that I'm trying not to. But I'm still like I'm not denying a point where it's like when I'm gonna feel the pain, I'm gonna be like, oh no, you know what? Give it to me.
Mhm.
But so far, I don't know. It's just, yeah, some people like are very, very against it. I'm not against it. I didn't hear like from my close people that it was something like very bad. Some people opposite said
Mhm.
it's like very good.
Mhm.
But I heard that sometimes the recovery could take like longer. Um and yeah.
Yeah. So now I think in terms of explaining what the epidural is, how it works, it's possible that that'll make you feel more comfortable in terms of getting it, or less comfortable, and you'd rather avoid it unless you get to a point where you feel like you need it, or you want it. So basically, it's a when you're in Pennsylvania, so I can tell you how Florida works. And I find that every state and every hospital sort of has their own protocol, but typically they give you at least one full bag of fluids before you get the epidural. And it is to help make sure that your blood pressure doesn't bottom out, meaning it doesn't get so low that it affects the amount of oxygenated blood that the baby is getting. So that's certainly something that needs to happen. And if I have a client who says, I for sure want to get the epidural, I tell them that as soon as they get to the hospital, they should ask for the IV fluids. Some hospitals require one full bag, some require two full bags, others require three-quarters of a bag. Others say just as long as you've been getting fluids for the last 45 minutes is fine. So every hospital is different in terms of their protocol, and asking your doctor or midwife what the protocol is for your hospital is really important. So once you've gotten the IV fluid, until then you've been able to walk around. But once they sit you upright and put that needle into your spine, which is about halfway down your spine, and basically it works with gravity, so it goes down your spinal column and into your legs. Um, and anything below where they put the needle in, you will have a lot of relief. It doesn't get rid of all the pain. For the first hour or so, you really don't feel much at all. But after about an hour, you definitely start feeling things. And depending on the position of your baby, um, and especially the last few minutes or hour or so, most women feel tons of pressure. I can't tell you if you feel any pain or if it's just pressure because I've never had it and I don't exactly know how it feels. But I've had women say, like, I thought I had the epidural, I thought I wasn't supposed to feel anything, but you for sure are still going to feel, especially towards the end. Um, and so they give you one first dosage of the epidural, and then they have a continuous line that gives you little bits. And if you push a button, you can get what's called a bolus, which is a larger bit, but you can only have that every once in a while. And that also depends on the hospital. It's typically about once an hour. You can give yourself a bolus. As far as how it affects your postpartum recovery, you're not going to be able to move off the bed with the epidural until they stop it, which is typically when you're pushing. And then they won't take it off until about so they turn it off as soon as you are pushing, sometimes a little bit later if you need to get stitches, if you tore in your perineum, but then they don't take the actual catheter out of your back until at least 2 hours after you've given birth. And until that, you will not be able to get up. I've had some clients that aren't able to get up and out of bed until like 6 or even 8 hours after they've given birth because of the epidural. So that's something else to consider. And yes, it can impact the baby because it impacts your blood pressure. And I've seen it myself that I've had clients who do really well with the epidural and their baby's tolerated super well. And there are others that it affects the baby's heart rate so much that they've been taken in for a cesarean. Um, and especially if you're also getting induced or if your labor is getting augmented and you need Pitocin for that, for whatever reason, sometimes you need it, sometimes you want to be induced. But if you're getting induced and your baby is not tolerating the blood pressure drop from the epidural, then they also won't be able to continue using the Pitocin, which will necessitate a cesarean if the baby is at risk at that point. Sometimes you can fix the baby's stability by changing positions, but other times you just sort of like have to stop everything. And even when that doesn't work, then the cesarean is needed.
Is the epidural like longer is the labor? Like it's makes it longer for the push?
So that's a really great question. The evidence shows that it doesn't lengthen stages of labor, but if I want to talk about what's called anecdotal evidence, meaning what I've seen with my clients, is that if they get it when it's too early, then because they have to lie flat on their back, it will lengthen your labor because you're no longer able to use gravity, especially if you don't have a doula who's constantly encouraging you to move around. Because even if you have an epidural, there are still positions that you can be in, not just on your sides or sitting up. But you can even be on your hands and knees if you have the support of someone who can stay there by you. But typically, again, I'm in South Florida. We have an incredibly high, intervention and cesarean rate over here. Typically, if it's just a woman laboring with her nurse, the nurse will tell her that she has to lie flat on her back and not move. And so those sorts of things, if you're thinking about like maybe taking ketchup out of a bottle, and you lie the bottle flat, that ketchup's not going to come out. If you put it upside down and you shake it a little bit, then the ketchup is going to come out. And so it's so similar to a baby. If you help the baby come out, the baby will come out faster. If you lie flat on your back, it's going to take longer.
Also, is it a bigger risk than to have a tears when you have epidural because you don't actually feel like when you have that much of a contraction? So it is more of on the screen where they tell you.
That's a great question. I actually don't know if I've read the evidence on that specifically, but I can tell you that the best way to avoid a tear is to push the baby's head out slowly. And if you think about it logically, if you can feel what's going on and you're able to control the urge to push the baby's head out too quickly, then you're less likely to tear. But then again, it also depends on the elasticity of your perineum. It depends on the position that you're in. I do remember, I believe I read that squatting actually increases your risk of tearing. I might be wrong, but do you know about that, Chavah?
I've seen squatting and birth stools be a little bit worse for tearing.
Right. Okay. Yeah. Yeah. There's
Best for
some
tearing, I
evidence
would
for
say,
that.
like side lying or hands and knees,
Yeah.
or to prevent tears. Yeah.
Right. So there are definitely things that you can try to do. I wouldn't necessarily say that an epidural will lead to tearing. I think it's more what you're doing while the baby's head is coming out and also the size of the head. And if the baby's head molds, those things are more likely to affect rather than just an epidural on its own.
Is this
Sorry, I
anything?
don't have a straight answer for that.
Yeah. Is any like exercise or like you can do something before while you're still pregnant to try to avoid tearing? Because like especially as I having the first one, it's more common to have it and try to avoid it.
I think nutrition is really important. So if you're well hydrated and well nourished and you have good protein in your diet and you maintain the good collagen levels and good, I like Danina was saying, like good elasticity. Some people really benefit from perineal massage. Have you heard of that before? Like,
Yeah, that's what I heard of.
yeah, so there's different like approaches to that, and I think of it like when you're having your baby for the first time and you're feeling that big stretch, it's really nice to be able to, it's kind of like a way of conditioning your, like bringing your awareness to that area pre-birth, and you're simulating a stretch like with your hands, or some people use like a wand, and you're able to like simulate that stretching feeling, and then you're able to sort of say to yourself, okay, like relax and release and allow your body to stretch, and you kind of get more familiar with what that feels like. So it can kind of be a little bit of mental conditioning in that way. So that's nice, and it gives people a little more confidence. The second thing is, I do believe, I'm also a massage therapist, and I do believe that when we work tissue, we can bring more blood flow to the area. We can bring more, we can, like you're working out actual muscle. So I do actually feel like there are a lot of women out there who say that perineal massage was super helpful for them. Also, it just kind of connects you to that part of your body that's not a part of the body that every woman is just automatically connected to. So being able to have a little more familiarity with those muscles. And I think like people that have done it I haven't talked to anyone that's done it that said, oh, that was a terrible experience for me. I have people say like, that was a really great experience and I felt like it was valuable, or, I don't know if it was valuable. I don't think I've heard anyone say that was a terrible idea to do perineal massage. I'm not a big fan of the epi-no though. It's just not one of my things. It's like a device that you use to kind of like expand the vaginal opening. And I'm not a big fan just professionally, but that I like the idea of using hands. And
Right.
I wanted to just touch really quick on, can I circle back around to the epidural question?
Yeah,
And
sure.
I just had a couple of thoughts. Danina did a great job of saying pretty much everything I was thinking, but also knowing that you need to have a urinary catheter. So they do put a urinary catheter in. And personally, I had a baby with an epidural, and the urinary catheter was a really uncomfortable part. Generally, women don't feel it, but some women do. And it was really bothersome to me. And then they don't take it out for several hours after the birth. So that's something to know. And then also just, I think that in a first labor, so you don't know how you birth. Like everyone kind of has a general style of birthing. I think some labors are longer than others, and first labors are usually longer than second or third labors. But overall, you don't really know how your body does it. Your body might birth quickly, your body might take a while. And I think it's I think it's important to say that when you start labor and you stay active and you move around and you get into different positions and you can like walk around, sit on the toilet, get in your shower. I'm not even talking about early labor at home. And you establish that pattern before you go into the hospital or before you take any pain relief. It's just really nice for your body to be able to like Danina said, like use the gravity, shift the baby into the right position and work with your body a little bit. Also, it will increase your endorphins, which is your body drugs, in response to that sensation of being in labor. So I think that it's not a matter of so much of like, is the epidural bad or good? It's like, is it right for me at this point? And a lot of people I'm noticing, they get an epidural because they're afraid of what might come. They're like, well, it's starting to hurt and I'm afraid that I won't be able to get it when I want it, or that it'll hurt really bad if I wait. So I'm just going to go ahead and get it now. And then that's a lot of times that's when women get stuck in a really early stage of labor that's, not progressing. And then they need to give medications like Pitocin in order to augment the process and like make things happen more, quickly. So I think despite whether or not you end up getting an epidural, or despite whether or not any woman ends up getting an epidural, I think it's important to just try to give yourself some time to ease into the pattern of labor, upright, mobile, using gravity. When we want the baby to move down into the pelvis, we got to move the mom. So moving around in early labor is important, but also, resting is important as well. So it's just not really like a bad or good thing. It's just, it's what do you need? And first time labors can be longer. First time labors can take longer. So if you feel like you've been working for a really long time and you're needing that pain relief, it's not bad to get the epidural. It just comes with, certain pros and cons. But I think that like a lot of my first time clients, people who say, I really don't want the epidural, usually go without the epidural. But people who are like, I'm kind of on the fence, like maybe I'll take it, maybe I won't, like generally the first time moms end up taking it for the most part, because labor in a hospital is more it's less conducive to being in different positions, and you just really need some support if you're going to be like trying to work with your body without pain relief.
Right. I have people ask me what is like my pain tolerance, like
how would you know, right?
And I says like, I don't really know. I don't remember like having any like real, like maybe it's just my brain's blocking, like maybe when I was a child, but never had like very serious pains that like, I don't know if I'm pain tolerant, like it's a high, is it low? No
Right.
idea.
Also, it's really weird to think about is birth is the pain of something going right.
Right.
So what other reference point do we have as humans for pain associated with something going right? I can't think of anything that hurts really bad that's going as a signal that things are going well. So it's a little
I was listening to this year earlier today, and is this Rabbi David who's about Chavah into Breslov Hasidus. And it was so cool because he was talking about how Hashem doesn't give us anything good without first having us go through something really terrible. Because if you don't experience something bad, you'll never be able to notice the good. And he says, think about it this way. If you had no idea what birth was, you did not know how humans come to be, and you walked into a room and you saw a woman giving birth, you would think they're both dying. This is awful. This is horrible. Like nothing good is going to come out of it. But in reality, it's a very uncomfortable experience that gets you something amazing. And it's definitely not the same as, let's say, breaking your arm, because that is a constant pain that doesn't go away until it heals. With labor, what is really cool is that, first of all, it doesn't start off heavy. It starts off typically very mellow, and it's a great opportunity to be able to eat and rest and hydrate. And if you take care of yourself in the beginning, especially as a first-time mom, because early labor can be 10, 15, 20 hours, and you really should be able to sleep through a lot of that. Then when you get to the point where it's feeling more intense, then you'll be well rested and you'll be able to manage it a lot better. Think about having a really tough day on no sleep and you haven't eaten in the last 10 hours. It's really rough. But when you take care of yourself, then you're much better able to handle it. And you could have the same amount of pain experience and it'll feel a lot easier and a lot less painful than if you didn't do all the other things beforehand. So that's really something else to consider.
Yeah, also I heard the once the contraction becomes like very intense, like very like strong ones, they at some point like the stop is to be stronger. It just maybe feels worse because there's less break, like the rest time between them. So like at once they become like hard, it's already like it's gonna continue this way, just with the less rest. But yeah, hopefully. Is it important to have like a birth plan? Because I see everywhere in all the apps, in when you Google anything like about third trimester in Google or anything like that, it's everybody says about birth plan. And when I just went to my doctor, he's like, well, what birth plan you want to talk about? And no idea like what is it actually, like what it's supposed to include, maybe besides the epidural, like if you want or not. And my doctor told me they just, okay, when you're just gonna come, we're just gonna talk about like what you're gonna tell us like what do you want. Just some people take it too serious when they come with like a contract. It looks like that, like about the birth plan. And is it important? Is it like, if it's yes, like what maybe are the main things like it's good to include?
I think a good birth plan is 1 page maximum, because the way that it feels to the staff, like I noticed that when people bring in like the long pages and pages of stuff, I think that the best thing you could possibly do is just be really, really educated in what your options are. And rather than be married to like a certain set of things, I mean, they're going to ask you like, what do you want to do for the baby? Do you want to do vitamin K? Do you want to do erythromycin eye ointment, antibiotic eye ointment? Do you want to give a vaccine at birth of hepatitis B? They're going to ask you those things for the baby. And then of course they're going to want to know, like, do you want to be with an epidural, or are you open to pain relief? If so, what kind? I don't know. Nowadays, there's a lot of things that we used to put on birth plans that we no longer need. I mean, I think people put things like, leave the cord intact until it's done pulsating. Now, most hospitals are giving between like 30 to 60 seconds of time after the baby's out for the baby's blood to return to the baby. That's not always long enough, in my opinion. I see a lot of cords at 60 seconds after birth that are very full, and it would be nice for the baby to get all his or her blood. So that's one of the things that I tell that I advise my clients, like, you might want to ask for longer, or just say, hey, I want to see that it's empty. The cord is empty, that all the blood has now gone back to the baby, things like that. But I'm not seeing so many different things. I think a lot of doctors, I don't know if I would say roll their eyes at birth plans, but I think they're skeptical of birth plans because birth is so unpredictable, and there are things that like will just come up that, rather than say like, I really want to, let me think of an example, like I really want to avoid a certain intervention. Well, obviously that desire to avoid an intervention is valid, but like, what if the intervention is needed? Then I think doctors just want to see that their patients are like open. But then also the patient, I think that the client, the woman, birthing woman, should be really like well educated in her own, like use the pregnancy time like we're doing now to really educate. And that way you can make decisions as they come up in labor. I mean, that's just my take. I like writing a birth plan, but I like it for the exercise of what it does for the conversation. Like I sit with my client at our like a doula visit, and a doula and I'm a home birth midwife and a hospital doula. So I'll write a birth plan with them, but it's actually for the exercise of being able to talk through. It's an educational exercise versus like, this is an important piece of paper. Does that make sense?
Are you like advocate like to leave the cord like as long as possible for the baby? Or because I heard that there is a pros and cons for it. that a baby gets a lot of blood, and after deliver might not always be able like to, it's working already hard. So sometimes the bilirubin that it's working on, it might be harder. So like if it's the baby's preemie, the pros of getting more nutrition from it, it's much better. So like I heard that it's better to leave it, but if it's a grown baby, that it might be the higher chances of it getting yellow. So it's like maybe it's not like so good to leave it for a long time.
I've been leaving my cord intact for an average of 1 to 2 hours for the last 10 years. And I don't see very high incidence of any jaundice because the moms are breastfeeding well. They have good support with breastfeeding, and they're, putting their baby in the sunlight, and they're breastfeeding a lot. And I typically don't see a lot of jaundice. And I've heard that argument, but I don't personally see that in my practice. And I don't think that, maybe Danina have some more evidence based on that, but I personally don't think that cutting the cord, like, I think back to like the way we were created, and like we weren't created to come out and have somebody jump on top of the cord and sever it right away to prevent a bad thing from happening. Like I believe that like life was designed to work. So that I don't feel like the idea of, okay, like let's say the idea of vitamin K for babies. I mean, babies are born with a low amount of K, and that's not harmful, except in the very, very, very slight, like very rare possibility that there's like a deficiency, a vitamin K deficiency bleeding. However, I don't think babies were created like faulty because of the low K. I don't think babies were created like that getting too much blood is an emergency. Also, the stem cells, the nutrients, the hemoglobin, the extra oxygen, like I think there's so many more benefits to the baby receiving their cord blood. And if on the off chance that they do have a little jaundice level, like that can be remedied. I think the pros of leaving it intact for any baby outweigh the cons. But what do you have to say, Danine?
So what's interesting is I don't know if it's more than one study, but the evidence does show that there's a higher incidence of bilirubin, of higher levels of bilirubin with babies who have the cord intact for longer. But actually, that was connected to African American people, so people of African descent specifically, and if you are not, then the likelihood of that happening to you is pretty low. And there's lots of benefits, especially if anemia runs in your family, your child is less likely to have iron deficiencies in their childhood. So as someone who I myself have iron deficiencies, I've had it throughout my life. For me, it was definitely a benefit to leave the cord intact for longer. And also, when you say for as long as possible, you should know that, again, I'm talking about South Florida specifically. Like I feel like when you go into a hospital, you have to walk in with a shield and a sword, because hospitals here are really tough when it comes to having births with low interventions. But if my client says I want delayed cord clamping, they have to be very specific about the amount of time that they want, because to one doctor, delayed cord clamping is I think one said 20 seconds. Another one will do 1 to 2 minutes, and for me, delayed cord clamping is like 20 minutes or more. And my kids specifically, they don't get their cords clamped until after the placenta comes out. So
I like to say, please show me that the cord is white before we cut it, because that's more, but if they agree to like 5 minutes, I think that is probably nearly as good as you're going to get in a hospital.
Yeah. But I think the most important part of this specific argument is to have someone looking out, because you can be on top of it as much as you want during the labor, for whatever thing you've written on your birth plan or your birth preferences list. But when it comes to once your baby comes out, you're so infatuated by this like cute little baby that's on your chest that anything else, you're like, do whatever you want. And so if you can have someone other than the mother and the father saying like, oh, can you please wait? Or remember that my client said so and so, or, just bringing it up, that's really, really helpful, because I can guarantee that, first of all, you're not going to be as present when it comes to all of the medical interventions, and second of all, you're not going to want to. You really should, like, this is the time to bond with your baby, and it's not the time to be saying like, hey, do this, hey, don't do that, hey, can you wait longer? It's not the time.
Mhm.
Right. Is it also good to leave the baby like for this like golden hour, like to ask them for as long as possible? Is like a thing or?
Is it to leave the baby for the golden hour for what?
Like, is it like really brings like so many benefits, or whatever they just give you, like okay, you just have to go with the flow of a hospital? Because sometimes I do feel with the doctors, yeah, that when I might some ask questions, they already know kind of like they're already kind of sick of all the same questions. So sometimes you just want, okay, like I don't have any questions. Everything is okay, because they feel like any questions you have, it might be just from a Google. Like we know better. Because I asked one of my doctors, but one of the appointments, if the seatbelt it's a dangerous for having a baby, because well, it could be if we get it like in an accident or anything like that. Because I'm originally from Belarus, and by in our country, you legally, if you're pregnant, you cannot wear a seatbelt. Like they let you not to, they're not gonna give you a ticket for it. So my mom still lives there, and she asked me about it, like, oh, maybe you shouldn't wear it because it might be dangerous. So I want to ask my doctor. I saw on TikTok, which is like when I told her this first thing, she's like, no, you have to put it on like as a to cover on your shoulder, and maybe put it, you can like put it like in the belly or maybe like under, but like no, but I saw on TikTok, she's like, no, 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 you have to. I'm like, no, I'm gonna finish it. So like on TikTok that you can put the belt behind you and just put the strap on the shoulder. So the strap on the belly, it's not actually like on your belly, it's behind, but you would still have the strap on your shoulder. So like no, you have to wear it. So sometimes I feel like, yeah, the doctors might tell you, they might think that your questions like are stupid. They're like, we know better, like what is better or not. And I usually the type that I just trust the doctors, because I know they have been like through so much experience, and they know like what better to do. And so like, is it good to go just with the flow, like if the doctors put like pressure on you, or it's better sometimes to get a little like in a fight, yeah, and like, yeah, I need my dose like to leave the baby as long as possible.
So I think there are some things where the evidence is actually quite clear on where the benefits lie, and there are providers who just don't really care to follow it. When it comes to the golden hour, it's not only is it so clear, but it's incredibly beneficial, to the point where there are hospitals. I don't know about any other states, but in Florida specifically, there's this initiative where you can get what's called baby friendly certification. And so if your hospital has that certification that it is considered baby friendly, there are 10 rules that they have to follow. And this is meant to improve the outcome of the baby specifically. It's meant to lower infant mortality rates. And one of the main things is that the baby needs to have their golden hour. They need to be physically bonded to the mom for an entire 60 minutes before they take the baby to do weighing or measuring or shots or literally anything. So if your baby's born at 4:06 p.m., then they should not remove your baby until at least 5:06 p.m. Those 60 minutes are incredibly
And
beneficial.
usually, yeah, and usually our doctors are okay with that, or like from the experience that you had.
So what's interesting is once the baby's out, the obstetrician doesn't usually much care about what happens to the baby. That'll be more on the pediatric nurses that are going to be in the room. First of all, the main thing to remember is that it is your body and your baby, and they can't arrest you for saying no to something. I mean, not to say that they haven't tried, but typically you're allowed to say no to literally anything. So just as long as you and the baby are fine, there's no reason why you shouldn't be able to decline anything. Um, so saying, please don't take my baby for an hour really shouldn't cause any issues. Again, I don't know what the birthing climate is like where you live, but actually in Florida, where it's really not progressive when it comes to those things, they honor the golden hour pretty well now. In the last probably like 5 years, they're pretty good at it. They don't really have a problem with it at all. And
And it'd be really here.
yeah.
It's definitely here. Everyone's doing that. Here, so.
Yeah, there are certainly things that are becoming more and more common. Thankfully, I think as a population, we're moving in the right direction.
And when is this golden hour starts? Because right after the baby is born, it's still the placenta that you also have to give birth to. So it's like it starts after everything, the whole process is done, correct?
No, they really should, put the baby straight on your chest once the baby's out. You might even be able to catch your own baby. I don't know what it's like where you are, but as soon as the baby comes out of you, the baby should go on top of you, and that's when the hour starts. And you deliver the placenta while you are holding on to your baby, unless you're not able. If you're having some sort of adverse reaction to whatever, then you can ask someone to hold your baby for you. But most women do it.
Okay, got it. So what are the most important like thing the first in the postpartum, like after the natural birth? Like what are the most important to do?
Well, I think that the most important thing to do, like in what category, like in terms of your own physical body, right away, the baby, just
I
like
would
what
say the physical body.
you're saying, like what does it look like right after like what does it kind of look like
No,
for
it's
you?
like what it's like the best. I know you have to like relax, but how much is actually like, let's say, being in bed, it's like helpful. Like, should I still try
So
to be
postpartum
active?
recovery.
Yeah, yeah.
Okay. Not like the moments that the baby comes out, but in the days. I
No, yeah, that's I'm still reading like a books, like what is actually like happening. Like they still move you to the room and they help you. I know that whatever they give you in the hospital, you have to take. Whatever they give you for free stuff there. But yeah, what is the more postpartum like as a recovery after once I'm gonna get home? That's
okay.
more.
Perfect. So I want to talk for just a minute about like, because I didn't really get a chance to introduce myself, but I've
Mhm.
been a home birth. I've been involved in the world of birth and helping moms and babies for about 28 years. And I've been licensed as a midwife for over 20. And so a lot of my work is with moms birthing at home. I also do a fair amount of hospital, but a lot of my familiarity is with moms birthing at home. And the reason I'm saying that is because when you're in the hospital, there's a lot of disruption and distraction. And like, so there's a lot of like people complain, like they coming into my room throughout the night. They're coming into my room throughout the day. They're waking me up. They're taking my vitals. There's different papers to sign. There's a lot of, it's a sweet time. It's you and your baby and your partner. But it's also it's not super conducive, to really resting. And really, really resting is what you truly need. And so when I help a client have her baby at home, the nice thing about, and I'm not trying to sell home birth, I'm just saying what is the ideal in terms of resting after the birth is from the time you have the baby, you might get up to pee in the first like maybe hour to 3 hours after the birth. But then aside from getting up to use the restroom, like I'd really strongly advise the client not to get up at all. She should really be in the bed, horizontal, off her bottom, not doing a bunch of sitting. If she's sitting at all, she can be like reclining sitting for like a good 3 days. And we say like 3 days in the bed, 3 days on the bed, and 3 days around the bed or near the bed. And it's just another way of saying like, you need to be like, you're not trying to push yourself to get back to your body. You're not trying to, quickly get back. You're really using that time and you're really using that time to rest. And, if you think about it, you have a wound inside of your uterus, the size of your placenta. So a placenta it's about a salad plate size. And inside of your uterus where the placenta has been implanted, there's now like an open wound. So not only is it like the body needs to recover from the actual pregnancy, the labor itself, whatever happened in the labor, pushing out your baby, but also like physically there's an actual healing that needs to take place. So it's really important to be off your feet, lots of really good nourishing foods. If you eat meat, like meat, stews, like really like rich, hearty foods are really, really healthy, vegetables, and lots of good fluids, teas, things like that. But really resting is the most important thing. And I know it sounds so simple, but it's a lot of times it's difficult. And people who are not in the habit of resting, or they have kind of a mental idea about what resting means, like there's some cultures that are really into pro resting, and then there's other cultures that are like, they sort of see resting as like a sign of weakness, like you need to get back to your body and you need to get back to yourself. And that's not what the body needs at all. So I'm just encouraging like every woman to be really, really, um, you know, how do I say it? Like she should really wrap her mind around the idea of just really resting for at least a week. I prefer if she's really low key for like 2 weeks after the birth. It's going to reduce her bleeding. It's going to increase her like her ability to bond with the baby. It's going to decrease her pain. A lot of people call me. They're like, "Hey, Chavah, like I'm having a lot of pain and discomfort and pressure, and my stitches hurt." And I say, like, "Well, have you been resting?" And people, a lot of times the people who are complaining of more discomfort are the folks who are not really doing a great job of resting. Maybe they're not in the habit of resting. Maybe they don't have the support at home. Maybe they have other children, but ideally, once you get home from the hospital, you want to go straight in the door and straight to your bed. And ideally, I have clients, like I encourage them to be like skin on skin as much as possible in the first like couple weeks of life, because your baby doesn't know that your baby's a separate person. Your baby doesn't know that they're them. They think they're you. They don't have an identity in and of themselves. So it's really, really important that if they're in a bed, like if they're in a bassinet, like a couple feet from you, they're right there, but they don't know that you're right there. And so being skin on skin and establishing like it's better for breast milk if you want to breastfeed, it's just better for bonding overall. Baby will sleep better if he or she is near you or touching you, can smell you and hear you and all that. So overall, like you just want to be eating really well, nourishing really well, hydrating really well, and resting really well.
Do you recommend the belly band, like like this the tight, the one that you put like on a stomach postpartum? Is this is like
Be
too good?
good. I think it could be good. I don't really use it in my practice, just my clientele. It's not like that's not something that people have really like desired, but I think it can be good once you start getting up and around. But if you're not gonna, I don't think, maybe different, Danina. I don't think the belly bands are so much for when you're lying down as when you're like ready to get back up and kind of move around and stand and
Yeah.
walk a little. Do you know, Danina?
Yeah, I mean, so your organs shift at a place when you're pregnant, and you also have like a very large hollow belly after you give birth, and so having some sort of support around your midsection helps to stabilize all of that. But do not expect a belly band to, I don't know, get rid of your diastasis recti, or for it to make sure you don't get stretch marks, or for it to make sure you have a flat belly. It's none of that. It's really just to provide comfort in the postpartum period. And so if you don't want to do it with a belly band, which I personally find incredibly uncomfortable, you can just use like very tight, like yoga pants or bike shorts, which is what I personally prefer. But it depends on the person.
During the time you're in bed after the birth, you would say, like to use it when you're lying down?
Um, I just kind of use them all day. Yeah, I
Okay.
just put them on in the morning and take them off before I go to sleep.
Mhm.
Once, yeah, definitely once I start like walking around more. But even, I mean, even those first 3 days getting up to go to the restroom is, yeah, very uncomfortable. And I have to like hold my belly, so it's better to just have something holding it for you.
I loved my belly band after my births, but I didn't use it until I was like up, like
Yeah.
started to get up and really move around because
Oh, I
it's
find them
hot,
so
it's sweaty,
constricting.
it's uncomfortable, it's tight.
Yeah.
And if you're laying there, I don't know, I just kind of feel like
Yeah. I
they
think
cover a lot of
the
skin.
main right. I think the main recommendation from me is to always see a pelvic floor physical
Yeah.
therapist
hmm
afterwards,
hmm
because if you want to do anything with your muscles, or even your skin postpartum, they're going to be able to help you actually get that work done from the inside out rather than the
Yeah.
outside in. It's sort of like using a different conditioner, expecting your hair to grow out a different color, you
I
know?
love
Um,
pelvic floor physical therapy. I think it's
yeah,
wonderful.
yeah, it's great. Yeah, and they help with a lot more things than just your belly. They help with incontinence. They help if you're having problems with painful sex. They help with
Right,
your
constipation.
perineum, yeah, constipation, your perineum, just tons of things. They're amazing. Highly recommend.
hmm
Mhm.
I second
And
that.
yeah, and regarding the breastfeeding, I have also like, do you have like any tips or anything? I wanna try to breastfeed, and I have my sister-in-law who told me if I really want to, I can do it.
hmm
But I also heard from a friend, let's say that she just had a baby, that for the first 3, 4 days it was hurting. So like, is there any way, because it sounds not so much, let's say 3, 4 days, but if you think that it's every hour or two, that already becomes like a lot. Is there any way to avoid it? Is everybody has it painfully, or it depends really, I don't know, on a baby? And can you still like, is pacifiers, let's say, or any bottle feeding, it's good to combine it, or it's like sometimes the baby can get confused between it, like also pacifier, when it's good to start maybe using it, because I heard like in the beginning it's best not to, like, so what is like any tips or anything regarding like a breastfeeding?
I think so I teach like a lactation 101 class, and I think
Mhm.
the best advice that I can give is to learn about the common problems so that when they come up, you know that this is something that can be fixed. Because most of the women that I've come across who said I couldn't breastfeed either did not have enough information and education, or they did not have enough support to be able to get through that tough phase in the beginning. And to be honest, for probably like 85% of women, breastfeeding is not easy the first 6 weeks. It's not. It doesn't come naturally. It's not easy. It's uncomfortable. Sometimes it even hurts. I personally give birth to children with lip ties. They get it from me. I have a lip tie. And my mom, honestly, it was so great to have her as the person giving me her personal experience, because she didn't know anything about all the research that was out there, didn't know anything about lip ties or tongue ties or anything like that. She just told me, yeah, it's gonna hurt a few weeks. You'll get over it. It's fine. And I was like, oh, okay. And so I give birth and I have this incredibly painful latch that it's making me cry on the third day. And I asked the pediatrician, is my daughter lip or tongue tied? They're like, nah. And it turns out that my pediatrician didn't actually know what to look for. And I didn't find out until my daughter was 9 months old that she does have a lip tie. But by then, we've gotten over it. She figured out how to nurse with it. And I got over the pain in a couple weeks. And so when I had my second and we had the same issue, I was like, you know what? I know that this only lasts like 2 weeks and then I can just move on. And so I dealt with it 2 to 3 weeks, and then I didn't have any pain anymore. And then I continued. There are some women that because of the pain, they will stop, or because the baby's constantly crying, they will stop because they think they're not making enough milk, or for this reason or for that reason, they'll stop. But because they don't know what's going on. And to be clear, you can fix a lip or tongue tie. You can get it cut or lasered. I personally chose not to because I said to myself, the only symptom we are experiencing is that I am in pain, and I did it once before. I can do it again. For me, it wasn't worth it to surgically separate it. And funny thing is, my toddler, his actually cut when he fell about a year ago. And so if you lift up his lip, you see like two little flaps. So it's really funny. But 3 kids with lip ties, and we were fine. But that's only because of my mom telling me it's gonna hurt and you just get over it and you suck it up and you'll be fine. But if I hadn't experienced that, then the intense amount of pain I felt those first few days, I would have said, forget it, I can't do this. And then I would have been one of those who said, I couldn't do it. It was too much. And because you don't know when it's going to end, right? Because you don't have any frame of reference. So I teach my clients, like, this comes up and it's common. This comes up and it's common. This comes up and it's common. And this is how you fix that. This is how you fix this. This is how you know you're making enough milk. This is how you know your baby's not getting enough. This is how, and there's just so many things that you can learn about so that when they do come up, because they probably will, like a bleb or a clogged duct or whatever, when it comes up, you know that there's that you have options. And it's the same with birth. That's why I think also a birth plan is so important, is because it is an exercise in educating yourself in all of the different options, because there are so many other things that you can do during your labor other than epidural or no epidural. The same way that there are 100 things that can happen when you're nursing other than just breast or bottle. And in terms of introducing a passy, I don't know if you were here earlier on, but I shared that. So it is recommended that you do not introduce any synthetic or plastic nipples to your baby for the first 6 weeks. And I generally do follow that rule when it comes to my clients, especially a first-time mom. But my kids just don't take bottles and they don't take passies. And with my third, I actually did the opposite. It was like day number 3 and they were getting a bottle and he still doesn't take it. He only wants the nurse. But this isn't a very common problem, so I wouldn't be worried about that. Typically, the problem is that moms will introduce a bottle early on, and then the baby will prefer the flow of the bottle. It's not necessarily that they prefer the shape or the texture of the nipple of the bottle or the passy, but they prefer that it's easier to get milk out from a bottle. And it's hard work for them to nurse. But the thing is that it's so, we were made so perfectly that you have to consider that Hashem made it so that babies need to nurse. They need to be able to pull, because it helps to develop their jaw. It helps to develop the muscles in their cheeks, in their jaw, in their neck. It helps in their development. And so having it easy from a bottle is not beneficial for them. So if you're able to breastfeed and if you're able to like push it and have support from women who have breastfed, that's the most important thing, is to not surround yourself with women who have not, or men that have no idea. That's going to be, I think those are my suggestions.
Love it. Racheli, well, how lucky are you to get this private session with not one, but 2 experts
Right.
there.
That's great.
Amazing. And the most important thing that I got out of it, and I'll send it to your husband, 2 weeks of bed rest afterwards. That's it. That's
Minimum.
Minimum.
That's the bare minimum.
Get it. Thank you, Danina. Thank you, Chavah. I so appreciate that you spent the time and that you come out, even if it's only for Racheli. And I'm sorry, so many other people registered, but they didn't show up. But your patience and your experience and your knowledge, and I know that she benefited. I know I learned new things, and I really appreciate you.
Yeah, thank you very much. It was very, very helpful.
Racheli, I would be happy. I have a 4-part recorded childbirth classes that deal with the physiology and, anatomy and physiology, the coping, lots of different positions, lots of talk about, what are the complications that can happen? What do we do about it? And also like postpartum recovery and like breastfeeding and stuff. I'm happy to, if you want to pass your email to Iris, like I'm happy to just share those classes with you.
Sure.
Yeah, it's taught from like a out of hospital birth perspective.
Mhm.
So, but we do, it's okay. You can still learn a lot from it if you're having your baby inside of a hospital. It's no problem.
Oh,
Happy to-
sounds great. Thank you very much.
You're welcome.
And I have a make your own birth plan that I'd be happy to email forward.
Thank you.
Yeah.
Thank
And
you.
if I can make one suggestion, Racheli, every
Mhm.
time you make a meal, at least once a week, make double and freeze it starting now.
I
Got
love
it.
Very good
Don't
advice.
worry about the nursery. Your baby doesn't care what color crib it's in or what fancy stroller it's got or how many colorful outfits it has. But if it has a mom that's well nourished, that has good milk because she's well nourished and well rested, then that's what's going to make all the difference. Because I have personally seen it that there are women who did not drink and did not eat enough and they did not make enough milk. So if you can freeze at least one meal a week. You know, I didn't cook for a month after my baby was born. It was amazing.
That's wonderful. I
that.
had one small thing to add on to what you were saying, Danina, is like I like to encourage prenatal hand expression of colostrum, which is essentially a method in the last couple weeks of pregnancy where you learn to hand express or take out by hand a little bit of your colostrum. And it doesn't deplete your supply. In fact, it encourages your supply. It gives you the confidence to like operate your breast more efficiently. And if you get enough, you can save a little, which is nice for the baby to be able to get a little extra. We know that extra, you know, if they get sometimes if they get a little extra, it can help also in cases of mild jaundice and things like that. But it's overall a really great technique. And since the last like 3 years, I've been doing it with my clients, and I've seen like lots of more successful breastfeeding because of it. So that's just something to kind of plant as an idea.
Where do they store it?
I have
How do
people
they store it?
pull up 1 milliliter syringes and then freeze them.
Interesting.
So you basically have like, so they would collect it, they would put it in 1 milliliter syringes and then just
Right.
like what the date is and then put it in the Ziploc bag, you put it in the freezer.
Right.
And then
Oh.
like if they need a little, like let's say the breast milk isn't super plentiful in the first, which ironically, this technique makes it super plentiful. So it's kind of like you're really saving it, and then you don't actually, most people don't need it because they have so much colostrum. And the
Even
colostrum,
when they're sick.
yeah, exactly. The colostrum is it's really in your breast for the first 3 days after the birth, but you can really increase the amount of it by expressing some. So, yeah, just wanted to mention that. Thank you, Reese.
Love it. Love
Nice
it. Thank
to
you for everything. Really appreciate it.
Racheli.
Thank you so much.
Racheli will be in touch. Thank you for
Yeah.
joining
Thank
us.
you.
Okay.
All right, everybody, have a great night.
Thank you.
Bye.
Bye, everybody.